Good evening, everyone. Thanks for joining me. I'm Dr. Javier Placer. For those that don't know me, I can't really see you, but I'm hoping that you guys are doing great tonight. We're going to be talking about a very interesting topic today. We talk a lot in regards to this with a lot of my patients in clinic. It's all about the sacroiliac joint pain and a new technique that I'm using nowadays that has been very successful in helping a lot of people with chronic back pain. So let's start. Let's go with the first slide. So typically, when I see a patient, I think you want to go to the previous one. Yes, that one. The clinical presentation that I get in the clinic when the patient come and see me is they come describing how they feel, how this pain is affecting their quality of life, the ability to function. One of the statements that I get is that the pain tends to be very uncomfortable, especially when they're sitting. Trying to stand up from a sitting position, they struggle. We have to understand the SI joint is a joint that unloads the force from the trunk towards the legs to the lower extremity. So when we apply that first step when we're sitting from sitting to a standing position, that first 35 degrees is produced by that SI joint. So when you have an SI joint dysfunction, you're going to feel significant pain. Prolonged sitting hurts. Prolonged standing also affects a lot of the patient. Rotation, bending forward, things that we commonly do in our daily living. So those are the typical complaints that I get in my clinic, and I'm sure some of you do have. So if we go to the next one, we're going to be talking about some of the. I'm sure you guys been through some of these options already. Physical therapy, I think it's important to go through the physical therapy. Remember the SI joint, when we talk about problems in the SI joint, we talk about the overall dysfunction, and we want to correct some of that. Chiropractic care, I'm sure you guys been through the chiropractic treatments. We have patients undergoing a lot of the steroid injections, medication management, opioids, surgery, fusion, and so on. Spinal cord stimulator. I have some patients also after spinal fusion and spinal cord stimulator placed and being implanted, they still struggle with back pain. And one of the things that could be the source of culprit of that pain is the SI joint dysfunction. Next. So I want to talk a little bit about the anatomy and the physiology of the joint. And I have a nice model here that I can show you. So like I say, the joint it's a big joint. Honestly, it's right next to the sacrum. The spine is right above. Of course, the hip is right next to it. So that's why I said it's the joint that unloads the pressure from the trunk towards the lower extremities. It has two borders. Usually when we're young, in our 20s and early 30s, we have a very smooth border, and the gliding of that joint is really nice. We have a lot of structure, soft tissue surrounding it. So we have pretty good stability. As we get older, we start developing a lot of angulation in the joint, and that disrupts that smooth surface, creating inflammation and pain. A lot of people will develop arthritis due to it, and it can cause a lot of that hypermobility or hypomobility, either or. So it's a well-known source of pain. I see a lot of patients in my clinic. Of course, that's what I do. And I can tell you about 27 to 33% of the people that comes to my clinic with back pain, the SI joint dysfunction or sacroiliitis is a culprit of that pain. So we need to learn how to identify that source of pain. I know when we have pain, we tend to go to urgent care, primary care doctors. A lot of these doctors are not truly trained in investigate that specific source of pain, and they tend to discharge you with some medications and rest. And it can be frustrating when you don't see much of improvement in your system and your symptoms. So now we have a better understanding of what the SI joint pain can cause and how it behaves. If we go to the next one, I want to talk about with the soft tissue of the joint and the typical injuries that we typically see that can cause SI joint problems. There's four major ones. Number one is trauma. Trauma is the number one source of SI joint dysfunction or strain. It could be a motor vehicle accident, a fall. The second one is hypermobility or hypomobility. Usually I see it in females after pregnancy or during pregnancy that they develop a lot of laxity in the ligaments because of their relaxing hormone. It tends to cause a little bit of laxity in those ligaments, and sometimes it doesn't heal properly, and they have that overall dysfunction that will persist months, even years after pregnancy. The third cause of SI joint problem is inflammation. People that suffer from chronic inflammatory disease, patients with rheumatoid arthritis that presents with sacroiliitis could be another reason why they have a lot of that SI joint problem. And fourth, and most importantly, is what we were talking about earlier, is the arthritis. People will develop arthritis, and that can cause a lot of disruption in the mobility of the joint, and that can cause a lot of pain in a lot of patients. Symptoms, typically, I'm sure you guys all know this, back pain is the number one cause of source of pain from the SI joint. Also, you can have a pain in the buttocks and the groin, pain traveling to the groin or into your upper legs or thighs. Like we said, it gets worse when you tend to stand up from a sitting position, prolonged sitting, prolonged standing, rotation. I see a lot of athletes that does a lot of rotation, golf players, tennis players who struggle with the pain because of that SI joint dysfunction. You can go to the next. So I want to talk to you about the procedure itself. The procedure is very simple. I have this guy here. I can show you exactly what it is. It's an allograft that we insert inside the joint. Minimally invasively, I use less than an inch incision to be able to place that in there. The procedure is done as an outpatient procedure. You walk in, walk out the same day. And I say walk because you're going to be able to stand and walk right after the procedure. There's really not much of complication. I haven't seen anything yet. There's very little risk of an infection, and I haven't seen one yet either. And the recovery is really fast. If we go to the next one, that's what you guys were seeing. It's the allograft that I used to insert inside the joint. It creates more stability. Remember, we talk about the gliding motion. We want to maintain that interlocking mechanism within the joint, and this helps as we create a little more space, opens up the space, and create stability that is well needed inside the joint. There's no reason for me to go in and drill to get in there. No screws, no plates, none of that. No instrumentation is needed to do this. The procedure takes around 20 to 30 minutes to be completed. And like I said, you once we're done, you stay in recovery for another 10, 15 minutes, and then you're good to go home. Next one. We have a video. I'm going to show you the video so you can take a look at how the procedure works.
PainTech's LinQ is an innovative way to solve patients' SI joint pain, using SI stabilization with a minimally invasive medical procedure. Patients get long-term benefits and faster recovery than other SI fusion methods. The process is broken down into 4 steps. First, the Steinmann pin is inserted into the SI joint, between the sacrum and the ilium. There is no drilling involved. Next, the tissue dilator and working cannula are inserted, creating separation in the joint. Then, the broach rasp is inserted to create room for the LinQ allograft to fit comfortably and at the same time initiate decortication. The broach and rasp are removed with a simple unscrew, reverse hammer, and pull motion. Finally, a large graft window of the LinQ allograft is filled with DBM, and placed into the SI joint. The inserter ensures that the LinQ is positioned perfectly, allowing SI fusion to begin. This step helps create the perfect growth environment for LinQ to work. LinQ enables you to fix the pain, not mask it, allowing your patients the ability to take back their life again.
There you go. Good video. As you can see, very minimally invasive, less than an inch of incision. One thing is we don't have to go and screw anything. We just go from the inside and we create stability by putting that device inside the joint. So the minimal invasive small incision, and like I said, usually takes, if we go to the next slide, we can talk about the recovery. Yeah, there you go. Right after the surgery, you go home. We want you to not wet the area for 72 hours. Just clean it simple. Change the bandage if you need to. You typically see the patients 2 weeks after the surgery. I remove the stitches. And then 6 weeks of not much of major activity, no lifting more than 15 pounds, no bending, no playing golf or tennis, not just yet. I know you're going to feel so good that you want to do all of that. I have seen it with some of my patients, but you need to wait at least 6 weeks until that takes place, that fusion takes place. When I see you in the follow, we can talk more about what else we can do afterwards. I think we have a couple of testimonials that we like to play those videos for you. I can tell you about some of my patients. In my experience, patients, they do really well. I have had patients who have had spinal fusion, stimulators, seen many doctors in the community. They tell the patients that there's nothing else they can do for them. Once I see the patient, we do a proper physical examination and a proper diagnosis, and that's how we're able to help them with the procedure. Once they're done with the procedure, the quality of life changed significantly. We're gonna try to provide some of my patients' video to include. We have some videos of patients that have had this procedure done, and we would like for you guys to hear it.
Before the LinQ procedure, I couldn't walk very far. I was in so much pain that I was willing to try anything. I've had injections, and I've also had bricks inserted into the SI joints, and they were not working. When it came to the point of being confined to home and losing independence, my reservations went on vacation. If you're going to prescribe medicine, I'm not going to take it. He says, that's good, I don't prescribe it. So we're going to get along just fine. To me, it was like pain-free. And trust me, I've had more than my share of procedures. He got me all prepped, took me back there, and then they said, you can get up now. You're done? I mean, that's how quick and easy it was. I saw results right away. I just noticed that the pain is gone. It's great that I'm where I'm at. I'm back up and mobile, and I'm very thankful for every day that I live.
There you go. So there's typically some of the questions that I get in my clinic is simple question as how many days I have to stay. Well, it's an outpatient procedure. You don't have to stay in the hospital. Insurance coverage, Medicare covers the procedure. There's no issues or problems with that. The other questions that I get often is, if I had this type of surgeries, can I get this procedure? Well, yes. In fact, some of these type of surgical procedure will cause that SI joint instability to get worse. So you are a good candidate to get this type of procedure. And people that get this type of procedure can continue getting other type of procedures as well. It won't change anything. Can I still get an MRI? That's a good example. Yes, you can. CT scan, you can still get the CT scan. There's no interference with any of that. And will I get immediate pain relief? Well, I have seen it. You certainly can. At least in the first couple of days after, you might you might see some improvement. Significant improvement usually takes a few weeks, but yes, you can definitely see improvement right away. When it comes to with patients that have dysfunction on both sides, I have done both SI joints, but we have to, I like to do one side first and then let you recover from that one and then do the other side afterwards. So those are the typical questions that I get in my clinic. I'm not sure if there's any other questions.
If anyone has any questions, now is a good time to enter them in the Q&A section. If you can find
There's
that.
a way that you can type the question and we'll read it and we'll be able to answer those questions.
Right. First question, is this under full anesthesia?
That's a good question. And I do it under full anesthesia. Yes. I do a small incision and I do offer that option of full anesthesia, which is to be sedated for it.
Okay. Second question, will I be able to walk out normally or will I need assistance?
I have patients walking by themselves. Of course, we want them to be careful and it's always good to have someone next to you. Remember, you are under anesthesia right after the procedure. So I'm more concerned about that than the pain from the SI joint fusion.
All right. Third question, sounds like a wedge. One would use to stabilize a wobbly table. Is that so?
There you go. That's a good example. That's exactly what we do. We put that device to create that stability that is needed. Absolutely.
Okay. Next question, will I feel immediate relief?
Yeah, I mean, I don't want to say yes. I have seen it, but typically it takes a few days to a couple of weeks for you to start feeling better.
Okay. And does this require additional follow-up appointments or additional pain medication?
Well, if the pain goes away or improves, you might not need your medications any longer. Typically, I want to see the patient 2 weeks after the procedure and then maybe 6 weeks post-op or 8 weeks post-op to discuss the level of activity as we increase towards promoting better stability within the joint. Yes.
Okay. And last question we have is, can I have this procedure done immediately or do I have to go through other procedures or pain meds before deciding to do this procedure?
Well, we want to make sure that that is the source of your problem. So certainly I want to see you as a patient first. And number two, we tend to do a diagnostic procedure where I will inject the anesthetic into the joint to see if that helps you for a day or two. And if that helps, that tells me that you're going to be a good candidate for this type of procedure.
All right. That's all the questions we have.
Well, I appreciate you guys joining me. You're welcome to call us. We'll be happy to see you and answer more questions here in our clinic.